I'm David Valent, and I'm a MBA student at West Texas A&M University, and I'm here to talk to you about my paper that I wrote and to discuss the case study of my paper that I wrote for my communications course. And the title is Physician Shortages. Is telemedicine the answer? It's a very timely topic given that we are all facing the COVID-19 pandemic and an increased use in telemedicine. This case study analyzes how telemedicine is the future of healthcare in many ways, but also how the efficiencies in telemedicine can lead to reduced time spent by physicians in providing care, which will ultimately reduce physician burnout, which will also save costs and allow healthcare institutions to invest more dollars in training physicians, acquiring more physicians, and reducing the physician shortage issue. There are many communication components to the discussion of physician shortages and whether telemedicine is the answer. Telemedicine itself is a multidimensional form of communication, very much like an in-person healthcare meeting. Think of the old days now when we used to call our doctor or nurse and start to ask questions to triage a problem. Doing that over the phone was very problematic and often would lead to the healthcare provider telling you to come into the healthcare setting for further analysis. Now, with telemedicine, with smartphones and computers and other ways in which we can add dimension to that discussion, our healthcare providers are often in a position where they can tell us it is safe to stay home, that they can see us, they can tell whether we're well or whether we're not by engaging with us visually as well as verbally, and help make better informed decisions that increase the quality of the care they can provide us remotely as well as the efficiency of the care. And that is really the multi-dimensional layer that is being added through telecommunication is really the big improvement in technology that has led to telemedicine being a legitimate option for moving medicine forward. So in my case study, what we did is we analyzed first the causes of physician shortages so we could then better understand how telemedicine could improve some of those causes to the physician shortage issue and ultimately improve that problem. We also then identified specific ways in which you as healthcare managers or healthcare institutions can implement telemedicine into your own healthcare enterprise in a very strategic manner to improve care, improve efficiency, and ultimately hopefully reduce the problem that we're all facing in the United States, which is physician shortages. I'm going to look at those issues here with you today as we discuss them. Then I'm going to leave you with some critiques of my own case study and things that I look to follow up on from a research perspective going forward, as well as leaving you with some discussion points so that we can better analyze and consider what the issues facing us as healthcare managers are today with regard to telemedicine and physician shortages. So first, understanding the causes of physician shortages. We have an aging population in the United States, which means an increase in demand for healthcare. As individuals get older, they become more sick and have more needs to address their multiple comorbidities. And therefore, there's a stress on the number of healthcare providers that we currently have available. This leads to physician burnout because doctors and nurses and care providers are working more hours and they're becoming more stressed and their job is less enjoyable than it once was, according to many studies. We also have increased regulations, increased litigation, increased hours, reduced resources and dollars in many cases with decreased reimbursement. All of these things, including the use of other changes in our healthcare setting, including the need to constantly educate as it relates to changing technology and changing medicine, puts a stress on physicians that is leading to what we call physician burnout and is drawing doctors away from the profession at a time when we need more. So we have to make things easier on them or also make things more efficient so that we can make do with the number of doctors we have if that becomes necessary. Rural areas are being hit the hardest. It's harder to attract good physicians to those areas. And the COVID-19 pandemic is also bringing this entire issue to a head, as we are having trouble with academics in educating our next round of physicians. But we're also having a moment in time where technology and the implement of technology in healthcare has never been more critical or more relevant. Next, identifying how telemedicine can lead to increased cost savings and efficiencies, and therefore decreasing the physician shortage issue. Literature suggests that telemedicine can lower the cost of a visit with a physician by as much as 60 or 70% in some cases. There are no brick and mortar settings necessary for most telemedicine visits. There's quicker access. There's more efficiency with less waiting and less drive time. There's often an ability to avoid an emergency department visit, which can be very costly and very time consuming. Some research suggests that emergency department visits can be reduced by as much as 73% with the advent and implementation of significant and effective telecommunication, telemedicine efforts. Also, the problem of access to care in rural areas and second opinions for specialists in rural areas is improved and becomes more efficient with telemedicine. All of this reduces the amount of time that the doctor is spending, not only commuting, but also communicating in person, navigating the logistics of the office interactions and their patient interactions, and saving time because they're also avoiding repeat visits for patients that they don't actually need to see in person, that they can see visually through telecommunication and possibly steer them in the right direction a lot more quickly and efficiently. This reduces the stress on the physicians, it increases the efficiency of the care delivery, and therefore can possibly help us decrease the demand on the healthcare system, reducing physician burnout, reducing physician stress, and helping solve this physician shortage issue. Next, I want to identify some specific ways, if you are starting to agree or see or appreciate that these methods of implementing telecommunication can indeed help solve the physician shortage issue. One thing to keep in mind is the fact that change happens slowly or incrementally. We know that as a communications principle, that you should not take your patient population, your community, and force them to go to telemedicine only options immediately. That's not fair to your staff, and it's not fair to your patients. We must do this incrementally and thoughtfully. Telemedicine has been proven to be very good with managing chronic disease. It has been proven for very effective in most urgent care type visits for triaging issues rather than bringing people to the emergency department. And it also is good for second opinions. These are ways that we can slowly implement telemedicine into your setting as it continues to grow. Now, as far as a critique of this case study, I think the case study could have focused more on some of the negatives or challenges or hurdles to implementing telemedicine. It could have also addressed the other ways to decrease physician shortages. But more specifically, with regard to the hurdles and challenges, there are cultural barriers and a lack of telecompetence, which leads to people not wanting to implement telemedicine as their method of receiving care. Certain cultures are not as adept at using the computer or as trusting of the computer or their privacy. And certain individuals, particularly older individuals who haven't grown up per se with all of the technical experience to use telemedicine, may not be receptive to it at first. And that is something I'd like to further explore with additional research. So now I leave you with this, and these are questions outlined in our case study that we're discussing here today. If telemedicine leads to increased efficiency in the delivery of care, what other measures can increase efficiency and ultimately reduce the strain on the healthcare system? The next thing I want to ask you is, if COVID-19 subsides, will patients continue to want to engage in telemedicine as they have during this pandemic? Or will they want to get back to seeing their care providers in person? Next, how do healthcare managers manage telemedicine providers? There's less human interaction. What challenges do we face as managers? And lastly, how will patients respond to telemedicine offerings, and how have they responded thus far? Much research has been done to suggest that patients enjoy it and value it, but will that continue to be the truth as time progresses, or will people wear tired of telemedicine and wish they had that human contact? In closing, digital health and telemedicine is one of the fastest growing segments of healthcare. It solves many problems, but also brings with it certain challenges. We have to be mindful of that. But we also have to, in my opinion, and according to this case study, truly engage in an increased effort to implement technology and telecommunication, or we will be left behind. This is something that is necessary to increase the efficiency of healthcare and ultimately reduce physician shortages and the strain on our healthcare system. Again, my name is David Valent. Thank you for your time and consideration. I hope you enjoyed this case study and will read it yourself. Thanks.